Welcome guys, now I'm going to teach you the urinalysis and urine dipstick. Urinalysis is one of the bedside investigation that we commonly need for multiple reasons. The common indication for the urinalysis is UTI. Urinalysis means the assessment of the urine, and urine dipstick is just a part of the urinalysis. It is important that when we collect the urine sample, it is a clean catch urine, midstream urine. Before we do that, explain the procedure to the patient. It is important that they should not collect at the end or at the beginning of the stream, so that you can get actually clean catch urine. Before you do the urine dipstick, it is important that we look for the color, if there's any change in the color, and what's the color of the urine, if there's any blood or anything, and what's the consistency. These are the important things that we need to look for. Then you process the urinalysis with the urine dipstick. Now, talking about the urine dipstick, it is very easy. You might have seen the containers urine dipstick before as well. I just want to quickly go through this. For the urinalysis and the urine dipstick, there are certain things that you need before this. Make sure that the patient understands and they collect the right sample, appropriate sample of the urine. The equipment that you need for urinalysis is a container that contains the urine dipsticks. There are multiple of them. And a urine pot, a pair of gloves, a clock, or the stopwatch, tissue paper, and an apron. Before I show you the urine dipstick, I want to show you this container. It has the expiry date. Before you use it, it is important that you check the expiry of the urine dipsticks. And there are different manufacturers and they advise the time as well. If you look on this panel, this is the color-coded urinalysis interpretation panel. The function of this and how to interpret it is very important for you to understand. If we look on this panel, they have different colors and each row tells you of different medical problems with the patient. If we look on the columns on the left hand side, all the columns on the left hand side are normal, and all the columns on the right hand side, they are abnormal. The far you go from away from the left hand side panel, the worse the condition will be. It is important that you check the expiry, you check the timings of those colors as well. This is a typical urine dipstick. It has multiple codes on the color-coded litmus papers. So they change the color if there is any pathology according to the patient's condition. Normally, it should match just with the panel on the left-hand side. All the columns on the column on the left-hand side, all the colors should match with that. But if they are not matching, keep moving it away towards the right hand side and find out where the color is matching and make a note of that. That will tell us whether the patient needs any further investigation, whether the patient has any medical problem. It can tell us the presence of bilirubin, it can tell us the presence of blood in the urine, and also if there's any glucose like in diabetic patients. It is commonly used for the pregnancy test as well, but the strips which are commonly used for the pregnancy, these are different. This is mainly for the other medical problems. Now, when you want to perform it, it is important that you check the identity of the patient, explain the patient why you want to do it, then get all the material that I showed you in the beginning. That includes an apron, a pair of gloves, a stopwatch, a container, and urine dipsticks and tissues. You hand the container out to the patient, explain the patient how you should collect it. It should ideally be a clean catch urine That's midstream urine. If the patient is catheterized, we should ideally collect the sample directly from the catheter, not from the bag. That is also very important. After you have taken the urine sample, say for example, I have a sample in front of me, check the color of the urine, see if there's any blood, any redness, make a note of that. Normally the color of the urine is like straw color, and if there's any change in the color, that can be because of the medications like orange or any black discoloration of the urine. They are all pathological. We need to find it out. I will show you how to perform it and how to interpret. Suppose you have the patient and you have collected the sample and you have everything ready. Wear your apron and perform the urine dipstick. I will show you just now. Okay guys, now I'm ready to perform the urine dipstick. After making sure that you check the patient identity and you have collected the urine sample, and that is a midstream urine, look on the urine, look for the color. You can also smell if there's odor, any pungent smell can be because of the UTI. And fruity smell can be because of the diabetes. So making the note of those findings, take a urine dipstick out after checking the expiry of the urine dipstick. Take one stick out and close the lid, put it back and dip the urine dipstick in the urine sample fully. You do not need to wait for long. Make sure that it is fully dipped in the urine. Put on the towel and run the timer. Wait for the timer because you will need to know the time of different parameters on the urine dipstick. Here you can see all the parameters given on the left hand side of the container. After the time is over, start interpreting the results by comparing the urine dipstick with the panel. And if you can see all the colors, all the dots on the dipstick are matching with the panel in the left column, it means they are all normal. If any of them is not matching, then you move it towards the right and find out where the dot is matching in color and make a note of that. And based on your findings, you may need to perform further investigation. Say for example, if you find the urinalysis is positive for the bilirubin, it means the patient may have problem with the liver and you need to perform further investigations including liver function test. If the patient's urine is positive for the leukocytes, you may need to process and send the sample to the laboratory for MCNS. After the time is over, bring your urine dipstick towards the container and start matching from the left hand side and move towards the right hand side and make a note of any abnormal dot color in the notes of the patient. If you need to send the patient's urine sample to the laboratory for MCNS, make sure that you document and also start the patient on the antibiotics. This is all about it. Do not discard the urine sample until you have seen the result, because you may need to collect another urine sample if the patient is positive for the UTI or if you need to send the sample to the laboratory for further testing. So make sure that you keep the sample in hand until you have seen the result. Then document and investigate further if needed, start the treatment if indicated. That's all about it. Thank you.